We assess. We see that there is a problem with your movement. The knees are falling in, the shoulder is internally rotated, the elbows are dropping in the rack position, the lumbar spine is hyperextending when the bar's overhead. We identify what is causing that issue. Here, the knees are falling in. Whatever pulls the knees in is doing too much. Whatever should be pulling the knees out is not doing enough. Do you see how this now leads on from the mobility and stability work we've just been doing? Because if your knees are falling in, what is tight? Adductors, something that pulls the knees in, yeah? Adductors, those medial rotators of the hip, they're too tight. What is a good way to make them longer? Full circle, hey? What is weak, underactive, loose? Something that laterally rotates the hips, your glutes, your abductors, yeah? They're not doing enough, and that's where the stability stuff comes in. Remember, we just talked about mobility and stability, the importance of both. So now all we need to do is identify each of these different areas of the body, work out what is causing that problem, and then prescribe an exercise to fix it. Yep, and then we've closed that loop.